What the systematic review discovered is that the vibrators, by stimulating the nerve ending on the pelvic region, they actually...
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronsky, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. Hey friends, today's episode is all about vibrators and orgasms with Dr. Alexandra Dubinskaya. We discuss the benefits and drawbacks using a vibrator, men versus women using vibrators, sex and aging, the pelvic floor, and much more. Let's formally introduce my guest today. Dr. Alexandra Dubinskaya is a board-certified gynecologist specializing in female pelvic medicine, reconstructive surgery, menopause, and women's sexual health. She believes in advancing medical care for women through research. She has published multiple peer-reviewed journals and is a reviewer for several journals. She has contributed to several books, including Urogynecology and Colorectal textbooks. Dr. Dubinskaya serves as a chair of communication committee for the International Society of Sexual Medicine and is overseeing the promotion of sexual literacy through the Society's website, newsletters, and social media platforms. She is an active member, speaker, and presenter at the American Urogynecologic Association, International Urogynecological Association, International Society for the Study of Women's Sexual Health, North American Society of Sexual Medicine, and North American Menopausal Society. I hope you enjoy the show. Alexandra, thank you so much for being on the show today.
My pleasure. Thank you for inviting.
Yes, so I have, hot off the press, your paper. I was just bragging off the air about Alexandra's like, wow, you came prepared. Yes, I do. No pun intended, because the show is all about vibrators and orgasms. So the paper itself is called, Is It Time for Doctors to Prescribe Vibrators? A Systematic Review of Pelvic Floor Outcomes. And I have Alexandra here to talk about her research and the findings of this paper. So Alexandra, what surprised you in doing this research? And really, actually, let me backtrack. What motivated you to even do this research? And then we can dive into what you found and what surprised you.
Yes, of course. So I'm a physician. I'm a urogynecologist. So I take care of women who suffer with urinary incontinence, pelvic organ prolapse, frequent urinary tract infection, vulvodynia or painful vulva syndrome, sexual dysfunction. So I basically see those women every day in my practice, and I see how much they suffer. And in general, women pelvis go through so much during our lives, starting from puberty, childbirth, menopause, and nobody really talks about those changes, and nobody really instructs women on how to support the pelvic organs and how to prepare for these changes or how to do rehabilitation. So we all go to the doctor and we all hear them saying, like, make sure you eat healthy, you get enough sleep, you exercise, but nothing about the pelvis. So I was thinking, what can we give women, what tool we can provide them that they can maintain their pelvic health? And what I mean by that, for example, when women go through labor, it's a very traumatic experience for pelvis. It can cause some tearing, it can cause nerve damage that then women experience later in life, the consequences of that. Or when menopause happens and there is a fluctuation of hormones, it changes the structure of vagina, changes pH, and it affects how they organ look, how they function. So I was searching for a tool that can keep the blood flow going into the pelvic area. and that can be used in the comfort of your own home as often as you want. And we do know that vibration in general promotes the dilation of the blood vessels. And when the blood vessels are dilated, there are more blood flow going to the organs that those blood vessels supply. Mm-hmm. So why not using vibrators as a pelvic rehab for multiple conditions? So then I wanted to look in the literature and see what we know about it, what have been done about it. And basically what the systematic review discovered is that the vibrators, by stimulating the nerve ending on the pelvic region, they actually send the signals to the spinal cord. And as a result, they provided changes in sexual function. So women would experience changing in desire, in arousal, orgasm. And also at the same time, there was a study being done that showed that pelvic floor muscles, by receiving more blood flow, pelvic floor muscles are functioning better. So it can potentially help with their urinary incontinence. In women who had the pain in the vulvar region, actually by applying vibrators, their pain significantly decreased. So that's kind of a quick background and preliminary findings.
That's wonderful. And I have a couple of follow-up questions, because as I was reading your paper, some of those papers had internal, external stimulation, or both. And I'm curious, in your research, when you went through the systematic review process, was there a benefit to doing one versus the other, or not really?
It's an excellent question. And it's interesting that you ask me, because currently we're finishing up a prospective study, meaning we actually recruited women and gave them vibrators and instruct them to use the vibrators. And when we're creating a protocol, we had the same question: is there any difference between application externally or internally? I think there is, for several reasons. First, even though the pelvic floor muscles are all very interconnected, I think when you apply vibrator externally, it's a little bit too far from the muscles that participate in continence mechanism that prevents, that helps us to hold the urine. I don't have much backing of this theory, but in our prospective study, we actually decided to ask women to apply vibrators externally. Mm-hmm. The reason for that was because our population is predominantly more mature women with some postmenopausal changes. So not everyone would be able to insert vibrator vaginally, or the fear of having urinary tract infection would prevent them from using it. So based on the results that are coming up soon, we probably can further explore this theory if there is any difference in outcome with applying vibrator internally versus externally.
Awesome. That's exciting. Very cool. And how conscientious to consider the people in the research study as far as comfort and accessibility. So I just want to acknowledge that and appreciate that thoughtfulness in your research, and acknowledgement of different comfort levels and accessibility levels for folks. So thank you for that. My other question here is going to be about men versus women. So I know your study is focused predominantly on women. What do you know about the studies of vibrators in men? Because in my practice, I do often advocate men to use vibrators, and there's often this stigma around, like, when you even just mention the word vibrator to a guy, they're just like, me, a vibrator? Like, no. Or they would say, my female partner, uses one, but I've never considered using one. And there's almost the stereotype, or maybe the stigma, around using vibrators for themselves. But if they have like erectile difficulty, if they had prostate cancer that resulted in sexual dysfunction, I'm a huge proponent of using varying kinds of stimulation to support everything that you just named for women. So it would, I'm just applying that same theory. So I'd love to hear what your thoughts are on that, men versus women and vibrators and such.
Right. It's so interesting that there is this stereotype, even though in urologic practice, vibrators have been used for many, many years to stimulate like the penis and a scrotum to retrieve the sperm for example, men who is quadriplegic and unable to do it on their own. Um, and in general, it's similar how you have like a massager at home. It's not only for female parts of the family or like male parts of the family. Everyone has a back pain and everyone can use the massagers. Um, with vibrators, I think it's the same. And it depends on, I guess, open-mindedness. And another thing that I noticed in our prospective research that actually women um, whose partner were more open to try the vibrator, they actually had the better outcome.
Oh.
And it's not only findings of like our study. There is a study from several years ago, like a national survey study that showed that when women, like partnered women, um, have a partner who is open about vibrator use, they actually have a better improvement in sexual function. And also thinking about couples, let's say older couples, where men experience like erectile dysfunction or any other chronic illnesses, vibrator can be a tool that actually allow couple to continue being intimate and receive pleasure. And I think it's just a wonderful underutilized tool.
Thank you, Alexandra. That is so important, especially as you mentioned the aging population and sexual health. Can we talk a little bit about that? Let's destigmatize that because I don't know about you, but there seems to be this air of stigmatization around as aging and sexuality, that it's almost desexualized, like older people are desexualized in some way, or if you do see them having sex in some imagery or on the street having some sort of public display of affection, it's more of this like, oh well, that's really cute. But it's like, at what point does sex stop? Like, is there like at what point do we become like non-sexual? Oh, I hit a certain age, no, sex doesn't even matter, that doesn't matter for me anymore. Like, that doesn't happen. So I'd like to talk about that and unpack this a little bit more about sex and aging.
Yeah, it's unfortunate that at some point women like in general aging people consider to be asexual. But I think we're forgetting that sexual, pelvic, mental health, it's all very important and interconnected components of overall like general health and overall wellness. And if there is a dysfunction or something happening with one area of like sexual health or pelvic health, it affects health in general. And I think it's very important to remember. And even when people get older, that like sexuality is still present. It might change how they express it, um, but it's still important component of the general health. And it has been shown in studies that unfortunately, even among physicians, we stop asking women when they get to like 50, 60 years old if they have any issues with sex, and it's considered to be like even inappropriate.
Oh.
So right, and I think that's something slowly changing. And I think as we all age, we finally like talk more about menopause. It's more like becoming more socially appropriate. I think slowly people will realize that yes, everyone having sex, everyone having it in a different way. And again, um, vibrators can be this amazing tool that people sometimes use it as a warm up or just a tool to put them on the same page, on the same timeline in achieving orgasm, achieving pleasure. So I think it's very important to remember. And speaking about vibrator use in the aging population, we need to do more research in finding out if there is a certain settings, certain intensity are better as people age, because we do know that our nerve ending changes, our like perception of like touch changes. So it would be interesting to see what different preferences in choosing of vibrators or settings between like more mature women versus younger.
Oh, that is very interesting, and how the body just adapts. Speaking of adaptations, and again, I'm not sure if you can answer this or not, but there's this misconception that if you use a vibrator, I'm sure you've heard this, if you use a vibrator, that it's going to desensitize you in some way. Like you'll need more of it, or you'll need to have a stronger pulse or stronger stimulation because it'll almost desensitize you. What are your thoughts on that?
Well, if you take any body part and you're going to apply vibratory stimuli or any stimuli, at some point your body will adapt. But if you give your body with that body area a break and then reintroduce the stimuli, you're going to feel it again. Mm-hmm. So I think a common sense, yes, if you're going to use vibrator for an hour on your genital area, you're probably going to feel numb and irritated. So use it sparingly. And I think another like why people also talk about it. A lot of people can have orgasm in a certain way, like certain position with certain stimulation. And it's true for vibrators or let's say manual stimulation. If there is a certain things that keeps you going and makes you reach a big goal, you're probably going to search for it. And if for you it's a vibrator, you're probably not going to feel as comfortable or experience similar orgasm if you don't have a vibrator and you just do like a manual stimulation. But I don't think it's a fault of the vibrator. It's just how we as a people operate.
Right. And knowing oneself in that context, like exploring and also being flexible, because adding a vibrator is really, it's a playful tool. It's a tool. It's not the be all end all of a sexual engagement or responsible for overall sexual satisfaction. It's the intent of use, right? And knowing kind of what works for you through that exploration. But it even starts with exploration, which often we're not taught, especially from a woman's perspective, to masturbate, explore our bodies, self-touch, like it's okay. It's that kind of narrative is not the normal narrative, at least historically.
And then I think till these days, it's kind of figure it out on your own.
Right, exactly. Here you go, have fun. Like I don't know. Yeah. No, I totally get it. So I have, oh my gosh, a couple more follow-up questions, because you mentioned manual stimulation and the vibrator. And there was only one comment, I think, made in your paper around one paper, I think it was Sipsky's paper, that said there was no difference with manual stimulation or vibrator. Can you speak a little bit about that, as far as do we know if there's a significant difference, and if so, how do we know?
I don't think we really know about it. That paper was very interesting because they were comparing women who has the spinal cord defect versus not. Mm-hmm. I think stimulation in general would bring them more blood flow and would produce similar effect. But how different are the changes? I don't think we can like quantify it yet.
Mm-hmm. Right. So we still got to do some research around that.
Right. Yeah.
It sounds like, no, that's great. Because the other thing too is terminology around orgasm. So when you were going through your systematic review, how did researchers define orgasm? Because it is kind of all over the place, as if that's not my understanding of like how researchers define orgasm, what parameters they're using to measure orgasm. I can see how that might pose for maybe some lack of cohesiveness as far as the literature goes. What do you think? What's your thoughts on that?
Yeah, so there is no exact measurement. In reviewed papers, researchers will use like a subjective like outcome that women report if they orgasm better, worse if they have multiple orgasms. And there is actually a company right now, Leoness, who developed a vibrator that's being inserted vaginally and basically able to record the muscle contractions when you like reaching orgasm and just being aroused. And the amazing thing that they do is they collecting the data from all the users, like obviously the users who consent to send the information.
Right.
So they're forming this like a large database that hopefully we will know more about the chemistry and physiology of orgasm and how exactly to actually measure it.
Mm-hmm. Right, exactly. Because that's what for me, as far as just reading research in general on the topic, is like there may be a potential benefit, although the evidence really, as far as just the quality of overall evidence, but the way that people are measuring things, it's just kind of all over the place, right? So it's like, yes, and like
right. And I think what's also interesting, what's more important, having an orgasm or having a stimulation? Is it the time of stimulation that produces the positive outcomes because there is a blood flow going, there is a nerve ending being stimulated, or is it actually orgasm?
Right, exactly. And where does even orgasm come from?
Yeah, a lot of questions. We can do so much research in this area.
Right, exactly. So philosophical, because orgasm, it's really it is subjective. There's physiological responses associated with that feeling of intense pleasure or peak moment in pleasure, but it varies, and I think that's what also in general people think that it should feel or should be a certain way when it really in fact has limitless potential to be experienced by the experiencer.
Absolutely. And how it changes over the course of like lifetime. Like we do know based on this subjective, I guess, reports, that with age, orgasm tend to be like shorter and more muted and not as intense. That's why the older women, more mature women, might need a little higher settings of the vibrator.
Yeah.
But how it's changed for men, how it's changed for different hormonal changes in your life, it's still a lot of questions that hopefully we will have more answers sooner.
Yes, and it's to researchers like yourself that dive into this world of sexual health and ask the questions and stay curious. So we thank you very much for painstakingly doing all this research, because it's not easy. When I have researchers on the show, I always offer so much gratitude and respect, because it's not easy doing research. It's not easy at all putting this together. So I really do admire and have great respect for the work that you do.
Thank you.
Okay, last question, promise. Any adverse effects? So there's benefits, there's talk about benefits, but are there any barriers to using a vibrator, whether biologically or psychologically or social culturally? I always love that biopsychosocial umbrella. So are there any barriers to the use of a vibrator for people? And the second part to that is, are there any reported adverse effects of using a vibrator?
Yeah. Okay. So let's start with the first question.
Thank you.
So some barriers. Let's talk about physiologic anatomic barriers. The way how predominantly vibrators are designed can be very difficult for women, for example, or men who has an issue with manual dexterity. For example, like rheumatoid arthritis, or just having this like vibration on your one hand can also cause like neuropathy, like not like severe neuropathy, but it can get uncomfortable. So also the habitus, like if you have extra weight, it might be a little difficult to reach to your genitals with the vibrators that currently available, commercially available. Um, that's pretty much it that I can think of right now. The psychological, there are plenty of psychological barriers and cultural barriers. Anything from the religion. Some religions prohibit masturbation, and even though you use it as a let's say rehabilitation of your like pelvic area, the fact that you have a possibility of experience orgasm can preclude you from using it. It's usually the major religions, they're a little bit more like linear towards women masturbating, and more like they more tailored towards the men masturbating, but still it can be something, just the mental barrier for people to use vibrators. Culturally, it can be associated with the stigma of being promiscuous. Also, just the everyday situation. If you have 3 kids who can walk in your room anytime they want, it's not going to make you feel relaxed or comfortable with using vibrator. I heard from my more mature patients that they're very concerned that what if they die and their kids going to go in their apartment and they're going to find those vibrators? What they're going to think of them? So there are a lot of just cultural, situational barriers. And I think actually, as a physician, us discussing vibrators with patients can help overcome those barriers. I'm not saying everyone should feel comfortable and don't care about your culture and religion. I think it's just being culture aware and see the way how we can implement this intervention and this rehabilitation. And the second, what was your second question?
adverse reactions or adverse effects. Yeah.
So among the studies that was reviewed, there was no adverse effect reported. In general, in review of literature, there could be some irritation, but again, use your common sense. If you're going to use it for too long, it's going to be irritated. There were some very isolated cases where somebody would like lose the vibrator, but it usually happens more common when people insert vibrators anally.
Okay.
So it's very important if your patient practice anal sex or anal stimulation, just to use the vibrators with a more like wider base, so it has a lower risk of being kind of like sucked into the rectum.
That makes total sense. And I can't tell you how many people I've interviewed on this show who have talked about that very thing of incredible things you will find in one's rectum and beyond. So it happens. And we kind of have to talk about this so that people can be conscientious and safe about their sex practices, knowing how to work with their bodies and avoid such unfortunate circumstances.
Right. And also to your point, nobody talks about it, nobody educates people. And like, it's very difficult to lose something in the vagina, but in the rectum, because of the like sphincter muscles, at some point it's just gonna go in and can't come out. So it's just important to know, if you work with a patient, just to see what sexual practices they engage in and just give them a heads up.
So Alexandra, I know I said I had one more question. I have one more.
Go ahead.
This is such a wonderful conversation with you. Really, it's more for the clinicians and the practitioners. If we want to support our patients' sexual health, And maybe we are a provider that have never addressed sexual health with our patient, but are leaning into these spaces a little bit more and having courage to do so. How would be the best way to start that conversation with your patient, especially if you as a clinician maybe feel a little uncomfortable or unsure of how to go about, asking about sexual health?
Well, I would start with, actually, not every clinician have to feel obligated to talk about sexual health. But if you feel, and it's okay to feel uncomfortable. I think if you know, and be honest with yourself, if you feel uncomfortable talking about these issues, just know another clinician who is, and feel comfortable referring to that clinician, physician. I think that's already going to provide a lot of help for your patient and release you from the needing to discuss sexual health with your patient. And if you're a clinician who's really eager and passionate about it, but feel just uncomfortable, I think starting with being comfortable with your own sexuality, being able to ask yourself the difficult questions, that would be a good place to start. And then think about sexual health as any other health. Like, same way how you feel, like how majority of people feel comfortable if your blood pressure is okay, are you having headaches? It's the same organs. It's it's still health. It's still part of the health, and just ask questions. And just know the majority of patients actually would really appreciate that, because probably no one else have never asked them about the sexual health, sexual concerns. And at first it might feel awkward, but I think it's important to remember just as awkward as you wanted to make it.
Right.
So, and practice. The
That's
more you
right.
talk about it, the more comfortable you will be with that.
Absolutely, 100%, 100%. Okay, well, thank you, Alexandra. I really, really appreciate you being on the show today. It was such an enlightening conversation. For those who want to connect with you, follow you on social media, where can they find you?
I can be found on Instagram. It's a.dubinsky. On Twitter, Dubinsky -a. Yes, that's pretty much where you can find me.
Wonderful, wonderful. So I will be sure to link all of Dr. Alexandra's handles in the show notes, and link to her paper, her and her colleagues' paper as well. And again, really appreciate you being on the show and taking the time to illuminate us about vibrators.
Thank you so much for having me. I had a great time talking to you about it.
And to all of you viewers and listeners out there, thank you so much for being here. As always, in loving wellness for your pelvis, this is Dr. Susie. Until next time. Thanks for listening to today's episode. Be sure to visit my website, drsuzyg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.